Hello dear nail artists, in today's video we're diving into one of the most essential topics from Milady's technology book, Nail Anatomy. This is the foundation every professional nail artist must understand. It creates safe, lasting and beautiful, healthy result. The free edge part of the nail that extends past the fingertip. Now in this photo, direction of growth is upward. Its main function is to protect the fingertip and it naturally grows forward. Age typically white or milky in color, and it's the area where the classic French design is often created. The point where the nail separates from the skin and creates the free edge is called the exit point. There are two important exit points to consider when fitting a nail former or a nail mod. The exit points can either be in a straight line or diverge in a different direction, especially if the nail is damaged or deformed. Now we have the nail plate. The nail plate is the visible hard part of the nail made of keratin. It sits on the nail bed and serves as main surface we worked on. Whether it's applying gel polish, extension, or creating a design, everything happens on the nail plate, not the nail bed. You can see this photo, nail plate on the nail bed. So remember, the free edge is part of the nail plate that extends behind the fingertip and is most visible area on which we design. Now let's talk about the nail bed. Take a look at this photo. On the nail plate we can see a crescent shaped line. It's called smile line. This line marks the boundary between the nail bed and the free edge, and it plays a very important role in nail design, especially in classic French manicure. The shape of the smile line can vary depending on the natural shape of the nail. For example, on flat nail, the smile line appears straighter. On a curved nail or a narrow nail, the smile line is more rounded and less pronounced. On wide nail or fan nail, smile line can resemble a butterfly or trapezoid shape. So this crescent, the smile line, acts like a window that reveals the natural form of each nail. And since every nail has a different shape, each smile line is unique. Understanding these differences help us design nails that are balanced, flattering, and well structured. I've included it's from the Milady's nail technology book. The nail bed is the skin beneath the nail plate. It provides nutrients to the nail plate through the matrix, which is located under the cuticle area, which is located under the cuticle area. The nail bed also contains many nerves ending, which makes it very sensitive. It's connected to the nail plate by a thin layer tissue of called the bed epithelium. This layer helps the nail plate stay attached to the nail bed while still allowing it to slide as it grows. So remember, the nail plate and the nail bed are not the same. They are two separate structures with very difficult texture and rules. Move on to the matrix, one of the most essential part of nail anatomy. It acts as the nail's growth center. Without a healthy matrix, proper nail growth is not possible. In this area, matrix. If the matrix is damaged, nail growth can slow down, become irregular, or even stop altogether. This can be caused by one physical trauma, such as hitting or lifting the nail, infection or disease, which we as nail technicians do not treat, and that is a responsibility of a medical professional. Number three, genetic condition. Number four, when the nail plate is pushed too hard the cuticle area, damaging the matrix underneath. You can see causes where the nail plate lift away from the nail bed. This is often a sign that the matrix has been disturbed or injured. That's why, as nail artists, it's so important to understand the structure and function of the matrix to protect it and support healthy nail growth. The visible part of the matrix is called lunula. That pale, screen-shaped area you sometimes see at the base of the nail. But why the lunula visible on same nails and not on others? You can see this photo. It depends on the shape, oh my god, shape and length of the nail bed and nail plate. In some nails, especially those with a short nail, this one, or thicker skin, the lunula is hidden. In others, particularly with a longer nail, that one, the lunula is more visible. You can see in this photo. Lunula is visible, lunula isn't visible. Now let's focus on one of the most commonly worked on areas in nail services, the cuticle area. What many people refer to as the cuticle is actually made up of two different structures. Epinecium, living tissue at the base of the nail. The true cuticle, the thin layer of dead tissue that tightly adheres to the surface of the nail plate. As nail technicians, we primarily remove only the dead cuticle tissue, not the epinecium. There's a very important limit to how much we should cut. I often use the analogy of a clock to explain it. I imagine a clock face 12 to 10. We only trim the cuticle from 10 o'clock to 2 o'clock. This section contains non-living tissue and is safe to remove when done properly. If the epinecium or perioecium is damaged, whether through aggressive cuticle cutting, too much pressure from a nail drill bit, or a careless tool use, several issues can occur. Number one, infection due to a broken skin barrier, scarring or matrix damaging, which uh, which can permanently affect nail growth. Number three, formation of ridges, pits, or even aniculases. Aniculases is when the nail plates separate from the nail bed. Some people think that polish or gel should start right at the epinecium in this area. But if you look closely as shown in this photo, you'll see that applying gel directly over living skin causes problem. UV light cannot cure product over live skin. That result: 1. Incomplete curing, product lifting, higher risk of allergic reaction or infection. When a healthy nail does not grow, it means the matrix has been damaged. Now let's talk about the hyponychium, a small but important part of nail anatomy. In the area is the area of skin located just beneath the free edge. It serves as a protective barrier, preventing dirt, bacteria, and other harmful substances from getting underneath the nail and reaching the nail bed. Once this area is injured, it can become very sensitive and difficult to work with during nail services. So always make sure to apply your product just below the epinecium on the nail plate only, and leave a minimal killing gap for a flawless, long-lasting manicure. Respecting the natural anatomy of the nail, especially delicate area like the hyponychium, is essential for maintaining healthy nail growth and achieving safe, long-lasting result. Understanding the true anatomy of the cuticle area not only improve your technique, it also helps protect your clients' nail health in the long term. Now move on the nail fold. The nail fold refers to the skin that surrounds the side and base of the nail. It includes both the folds and the grooves that help guide and protect nail growth. There are two main types of nail fold. The proximal nail fold, located at the base of the nail near the cuticle. The lateral nail fold, found along the sides of the nail, also known as the side walls. The lateral nail folds play an important role in guiding the nail as it grows forward. They help keep the nail aligned and shield it from external trauma. However, these side walls, especially on the big toes, can sometimes become damaged or inflamed. When that happens, the nail may begin to grow into the surrounding skin instead of over it. This condition is called an ingrown nail, and it can be very painful and prone to infection if not treated correctly. Now, along the sides of the nail, we have two more important structures. One, the nail groove, slight indentation or track along which the nail grows. The nail bed, the nail wall, the raised skin that frames the nail on both sides. Together, these structures help guide the nail plate as it grows and protect it from external damage. But if the nail wall becomes swollen, irritated, or torn, it can lead to infection. This type of infection is called pernechia, a painful condition where the skin around the nail becomes red, swollen, and possibly filled with pus. So, as professional nail technician, we must always be gently when working around the nail walls and folds, avoiding one excessive pressure, improper cutting, any action that could damage the surrounding skin. We have two distant bumps which we call nail cushions that usually bother us when applying the former, and for this reason we cut the former so that it does not touch the cushion. When we apply pressure to the free edge of the nail, this spot turns white and is called the nail stress point or sensitive spot. This area usually breaks due to impact, which is the only way to remove the nail. Understanding nail anatomy isn't just a foundation of safe, long-lasting, and healthy nail services. We respect each layer from the matrix to the free edge, not just creating beautiful nails. Protecting our client and preserving the integrity of their natural nails. Thanks for watching. Don't forget like, subscribe, and leave comment. I hope this video helps you. See you in the next one.